Hi, today I will tell you a bit about hepatitis B. What is hepatitis B? Hepatitis B is a disease caused by hepatitis B virus, HBV, which infects the liver and causes an inflammation. Now for a bit of history on hepatitis B. Originally known as serum hepatitis, the disease has caused epidemics in parts of Asia and Africa, and it is endemic in China. About a third of the world's population, more than 2 billion people, have been infected with the hepatitis B virus. What causes hepatitis B? Hepatitis B is caused by the hepatitis B virus, HBV. HBV is a non-cytopathic virus. This means that the virus itself does not cause direct damage to liver cells. Instead, it is the immune system's aggressive response to the virus that usually leads to inflammation and damage to the liver. However, HBV can cause damage to the genetic material inside liver cells. This can lead to liver cancer, which, like hepatitis, can also be fatal. The hepatitis B virus is a DNA virus, meaning that its genetic material is made up of deoxyribonucleic acids. It belongs to a family of viruses known as Hepatnoviridae. The virus is primarily found in the liver but is also present in the blood and certain body fluids. Hepatitis B virus consists of a core particle, central portion, and a surrounding envelope, outer coat. The core is made up of DNA and the core antigen, HBCAG. The envelope contains the surface antigen, HBsAg. These antigens are present in the blood and are markers that are used in the diagnosis and evaluation of patients with suspected viral hepatitis. What causes hepatitis B? How is it spread? Risk factors. It is spread through contact with the blood and body fluids of an infected person. You may get hepatitis B if you have sex with an infected person without using a condom. Share needles used for injecting drugs with an infected person. Get a tattoo or piercing with tools that were not cleaned well. Share personal items like razors or toothbrushes with an infected person. In a special case, a mother who has the virus can pass it to her baby during delivery. If you are pregnant and think you may have been exposed to hepatitis B, get tested. If you have the virus, your baby can get shots to help prevent infection with the virus. You cannot get hepatitis B from casual contact such as hugging, kissing, sneezing, coughing, or sharing food or drinks. Some symptoms and signs of hepatitis B. Some hepatitis B symptoms that are especially common in the early stages of the disease include fatigue, diarrhea, nausea or vomiting, and a low-grade fever, muscle pain, joint pain, sore throat, mild abdominal pain or stomach pain, dark urine, light-colored stool. However, not everyone infected with the hepatitis B virus will actually have symptoms. Also, some of the people who do develop symptoms will have only very mild symptoms. In fact, about 30% of people with this disease will have no symptoms of hepatitis B. You can look and feel perfectly healthy, yet still be infected with the disease and infect others. Possibility of transmission. The hepatitis B virus is known as a blood-borne virus because it is transmitted from one person to another via blood or fluids contaminated with blood. Another important route of transmission is from an infected mother to a newborn child, which occurs during or shortly after birth, which I already stated earlier. There are many ways to diagnose hepatitis B. Ways of diagnosing include liver biopsy, blood tests, liver function tests, and many more. As for the cures and treatments, acute hepatitis needs no treatment other than careful monitoring of liver and other body functions with blood tests. You should get plenty of bed rest, drink plenty of fluids, and eat healthy foods. In the rare case that you develop liver failure, you may need a liver transplant. A liver transplant is the only cure in some cases of liver failure. Some patients with chronic hepatitis may be treated with antiviral medications or a medication called peginterferon. These medications can decrease or remove hepatitis B from the blood and reduce the risk of cirrhosis and liver cancer. Liver transplantation is used to treat severe chronic hepatitis B liver disease. Patients with chronic hepatitis should avoid alcohol and should always check with their doctor or nurse before taking any over-the-counter medications or herbal supplements. This even includes medications such as acetaminophen, aspirin, or ibuprofen. How will this disease affect the daily life of a person? Well, the acute illness usually goes away after 2-3 weeks. The liver usually returns to normal within 4-6 months in almost all patients who are infected. Some people develop chronic hepatitis. Almost all newborns and about 50% of children who become infected with hepatitis B develop chronic hepatitis. Less than 5% of adults who are infected with the hepatitis B virus develop the chronic condition. Chronic hepatitis B infection increases the risk for liver damage, including cirrhosis and liver cancer. People who have chronic hepatitis B can transmit the infection. They are considered carriers of the disease, even if they do not have any symptoms. Hepatitis B is fatal in about 1% of cases, but to be safe, you should seek preventative care by taking the HPV vaccine, which is typically given as a series of 3 or 4 injections over a period of 6 months. Sadly, 2 billion people in the world have been infected with this disease. 10 to 30 million get infected each year. Luckily, most healthy adults, 90%, who are infected will recover and develop protective antibodies. Just remember to not share used needles or anything that has been exposed to blood with anyone, and always use protection when having sex to avoid transmission of the virus. It's better to be safe than sorry. Be safe. Bye.